All right. Thanks, Brian. And I want to make sure I welcome all of you here. I mean, this is going to be a special treat for you. And as I'm explaining who I'm going to be talking to and why this is so important, what I want you to do is in the chat box, so you get used to using that, go ahead and tell me where you're coming from, where you're living, where you live right now, where you're from. Let's get the interaction going, get the excitement going, because who I have for you he's become a great friend of mine. And just in a short amount of time, we met at an event like a little over a year ago, geez, maybe almost 2 years. And we just hit it off right away, especially because I saw what he was doing in the brain health world. And I was about to launch my Superhuman Brain Masterclass. So this is like, in addition to it, he wasn't even on that one, but the stuff that he was doing and now has continued to do, you're going to learn about like this really cutting edge, especially as it relates to the treatment and reverse of cognitive decline and not getting to the point of Alzheimer's disease. So what we're going to do today, just like Brian had said, is the first 20, 30 minutes, at least, I'm going to be asking Seth questions. He's going to introduce himself and give you a little background about him too. I'm going to ask him some questions. It's going to be real casual. And then we're also going to show some slides, because that really hits home, helps you to fully understand what's happening in the world of brain health, especially with Alzheimer's disease and what you can do to prevent that. As Brian said as well, put your questions in the chat box as they come up, and we'll definitely get to those at the end, the last 20 or 30 minutes or so, okay? So excellent. With that, I want to introduce Seth Conger. Welcome, Seth. Thanks for joining us.
Hey, Dr. Ryan.
Well, what I want to start off, good. I want to start off with this because, like I said, we hit it off right away. Your story is amazing and how you got into the whole brain health arena. So I want you to share that with all of us. How did that happen?
Thanks. So, normally when I'm in front of crowds having conversations, I like to ask the question first from the audience of how many people know someone or have known someone with dementia or Alzheimer's disease, which is the most common form of dementia. And usually 80% of the hands go up. Sometimes 100% of the hands go up. And I am too. My hand always goes up because my grandmother had dementia. And it was a long, arduous road. It wasn't fun for her, wasn't fun for any of us. And I can remember the day that my grandfather, Jack, told us all that she forgot who he was. The devastation there was just awful. I was pretty young when it happened. And after she passed, he made it about 3 more years. And we started to see the same signs in him too. And he recognized them. And because of the pain of the process, he decided he didn't want to go down that path. And he ended up taking his own life. And Jack was my hero. He taught me how to ski when I was a little kid. He taught me how to think for myself and ask questions about why things were a certain way and demand different circumstances and different results. And I was actually experiencing a different form of cognitive decline at the same time. So when my grandfather passed, I had had head injuries in high school from high school sports, and they changed my entire trajectory in life. I was expecting to be a doctor. I was on the pre-med track. And by the time I got to college, I couldn't even comprehend the words on the pages of my biology textbooks anymore. So I went down the traditional path that many people take, right? You go to your psychologist. And I was told everything from I was probably homesick to I wasn't as smart as I thought I was. Maybe I was a big fish in a little pond. I went to a medical doctor and they told me all my test results were within a normal range. I finally went to the dean of students and he said that I probably just wasn't cut out for pre-med and I should do something easier. And, no one had any answers for me. So I just believed that that was my brain for a number of years until I found integrative medicine. And somebody finally asked the question, Seth, have you tested your brain function? I said, well, I don't even know about that. I know it's not functioning well, but no, I didn't know you could test it. It was a really simple computerized test. It took me 30 minutes and it showed me exactly where in my brain function was off and what I could do about it. That set me on my health journey to improve my brain function. And then after years, of doing that and helping hundreds, even thousands of people regain their brain function, we decided that we needed to fill the gap of a lot of the issues in functional integrative medicine and traditional medicine. And that's why we created Mios Health.
Man, I've heard that story a few times, and it still gives me a visceral reaction to it. Like just like a pit in my stomach, because I can see my story in that too, where my grandma, the last year of her life, again, was wasting away in a hospital, not even a hospital bed, but a assisted living, care living facility. And again, she just slowly went downhill. And what are we told in the traditional medical realm is, well, yeah, she's old. She was in her 70s. It wasn't like she was in her 100 years old. So yes, that's why I'm so happy to bring this to everybody here, because we need to find out why is it so bad. And similar to you is I've experienced that cognitive decline, where mine has been is more like what I call low brain energy, whereas just by midweek, the end of the week, I'm just from making all these decisions and planning, and it just zaps my brain.
Yep.
And I've learned how to obviously mitigate that and heal my brain just like you had, but there's got to be an easier way to do it than probably what we went through doing that. But first, I mean, the big question, we talk about Alzheimer's. Alzheimer's is, I think we both see it. We both believe that it's the most personally and financially draining disease that you can get. And especially if you have dementia or Alzheimer's or a loved one, you can see that. So, but first, how big of a problem is Alzheimer's?
Yeah, so Ryan, it's a huge problem. And I'm going to share my screen here so that everybody can kind of see the seriousness of this issue. So the Alzheimer's disease epidemic currently costs $280 billion a year. Now, the Alzheimer's Association is projecting it's going to triple in the next 20 or so years, and it'll be up to $1.1 trillion per year for Alzheimer's alone. Not any of the precursors to Alzheimer's, just Alzheimer's disease. So the average lifetime cost is $365,000 per person. And what's really scary about that is a lot of people think, well, that's going to be covered by insurance. And the reality is that only 30 to 70% of that is out of pocket for people. 30 to 70% of that cost is out of pocket. And there are no effective pharmaceutical solutions. In 20 years of research, $65 billion has been spent with a 99.6% failure rate. In fact, most of the large drug companies have actually pulled out of Alzheimer's and dementia research because they realized what we realized in the functional and integrative fields, that Alzheimer's is a multi-causal disease. And it takes 20 to 30 years to develop in the brain before symptoms even present themselves. So a monotherapy, a single drug, is never going to be the solution for a multi-causal problem. And so that's the epidemic that we're dealing with right now. 1 in 9 individuals over the age of 65 develop Alzheimer's disease. 1 in 5 if you're a female. And that's incredibly scary when you realize that Alzheimer's disease takes more lives than breast cancer and prostate cancer combined.
Well, and just in the US, it's the 6th leading cause of death.
Yes.
Right?
Yes.
Yeah. So we have to understand what happens before that happens. And that's what I want you to explain is, because you mentioned it happens, or this process starts 20 to 30 years before it progresses to what doctors can say, okay, you have Alzheimer's disease. Yes. So what does happen before that point in the brain?
Yeah, so we call that point before pre-Alzheimer's, like pre-diabetes, before diabetes. So Alzheimer's disease is that point where you lose your independence of getting through your day-to-day functions. And there's 3 clear stages prior to Alzheimer's disease. Now, only one of them is diagnosable, mild cognitive impairment. But the others present a higher and higher risk factor on your way towards that point. So preclinical Alzheimer's disease can start 30 years before symptoms present themselves. And this is at the point where you say, I have a family history, I have some risk factors, and I'm wondering where my keys are. I'm wondering if this is normal or not. They're not on the key hook, so where could they be? And then you find them on the table, which is pretty normal, right? We misplace our keys, and that's fine. Subjective cognitive decline is one step further and a higher level of risk where you really know something's going on. And you may forget your keys and they're not on the key hook, and they're not on the table. And you find yourself retracing your steps through your house, and 5 minutes later you find them on the bedside table, which again is not that out of the ordinary because we put our keys on the bedside table before we go to bed, but you don't remember putting them there. That's subjective cognitive decline. And if you go to your doctor's office, they may say, well, your symptoms aren't bad enough yet, and I don't recognize them. And you can repeat 5 words to me. So we're okay. Let's just wait this out. And then the next stage is mild cognitive impairment. And here you might hear, honey, why are your keys in the refrigerator? And now you know you have a problem. Everyone else knows you have a problem around you. And the basic testing at your primary care provider's office or a specialist office like a neurologist will tell you that you have a problem. Alzheimer's disease, you may wonder what your keys are for in the first place. And those are the stages. So from where are my keys to what are keys for, that can be 30 years of time in development.
Yeah. And that, sometimes I think it might give people like a false sense of security where this is normal or this is the normal part of aging. But you see in the graph right there, the normal part is in the green. It's
right.
Not that black. That's a steep decline. And it's gradual over time. And you think you have time. Okay, I have time. This is something that my mom and dad had, and they, maybe they did develop that into dementia or Alzheimer's or maybe another neurological disorder, because that's, a whole other issue as well. But how, I love the analogy that I've heard that you give, like what is actually happening with Alzheimer's, because analogies, stories, examples help get it in the attendee's brain, if you will. Sure. What is actually happening?
Sure. And Ryan, I think you hit on a very important point there. Time. Most people think they have time to delay and time to put off, but really they have time to do something about it, time to discover, time to take action. And we'll get to that, towards the end, but the time is now. The earlier, the better. Just like in anything, investing in your finances, the earlier you start, the better you're going to be off in the later stages. So I like to use an analogy of a bathtub. So I want you to picture that you have a bathtub, and I'm talking to all the attendees here. So picture you having a bathtub, right? And your genetics define how large your bathtub is. So you and your neighbor or you and your spouse may have a different size bathtub. Now, all bathtubs have a couple different elements. You have the faucet that has the water, and you can control how fast or slow that water is coming out. Now, water has to come from somewhere. Water comes from a source. So that source is your environment. The water coming out, that's your lifestyle, right? That's your exercise, it's your nutrition, it's the way you manage your stress, it's your sleep. It's the purpose you have in life, how you challenge your brain and your body. Now, there's always a drain at the bottom of the tub too. I want you to think of this as your immune system, right? This is there to defend and repair things and to clear out anything that's bad in your system. Now, we all want to have a certain level of water in the bathtub, because if you don't, you can't get clean. And that level of water is your life. We want to have a good time. We want to enjoy life. We want to be happy. We want to do fun things. We want to be crazy every once in a while. And if we don't have some level of water in there, then life is no fun. But over time, that water level tends to rise. And the water tends to get a little bit dirtier and dirtier, which clogs the drain at the bottom, and we don't do much about it. And so eventually, at some point, the water just crests over the edge of that bathtub and it starts spilling out onto the floor. And that's going to be your first sign of symptoms, usually memory symptoms, when we're talking about cognitive decline. Most people don't do anything about it until the entire bathroom fills up with water and starts flooding. And you go into your doctor, and what do? They hand you a bucket and they say, start bailing. And if you're bailing right back onto the floor, it's not helping you. They may even seal off the door so it doesn't get out into the rest of the house. So instead of bailing, what would be a better way to look at this? Well, we want to look at where's the source of the water and what's the environment that you're living in. We want to understand how fast and slow that water is coming in because you have control of that, and that's your lifestyle. Are you doing the right lifestyle techniques and habits for you, or are you just kind of letting them go? And we want to check that drain at the bottom. We want to make sure it's not clogged, because if your immune system's clogged, then it's either reacting too much or it's reacting too little, and that bathtub is filling up. So we want to maintain that level at a normal weight. And that for the brain in Alzheimer's disease, that means we have a balance between good things coming in and bad things getting flushed out. And too much of the bad is going to tip the brain towards decline. So with this, we know of a number of risk factors that are going to fill that bathtub up quicker than the drain is going to lower it. And the fact of the matter is Alzheimer's is actually a combination of multiple different risk factors. Genetics is just one risk factor. And in fact, your lifestyle is a much higher risk factor than genetics alone. So we know of about 50 different factors that can lead your brain towards decline, or if done in the right way, can lead your brain towards improvement. And what we see, Ryan, is about 10 to 15 different factors in combination with each other before the first sign of symptoms. About 20 of those factors in combination before you would receive a diagnosis of mild cognitive impairment. And these are all things we can search for. They're all things we can identify. And this is not an exhaustive list. This is just a showing what a few of those are, like hormone imbalances, inflammation or neuroinflammation, chronic stress, traumatic brain injuries. That would be like dropping a basketball into your bathtub and displacing that water at the very end. Infections, viruses, hypertension or type 2 diabetes or high blood sugar. All of these are separate risk factors. None of them are single causes. Remember, this is a multi-causal disease. So they're not single causes of Alzheimer's disease, but together they increase your risk factor of developing that disease.
And I love how you put it together. It's a multi-causal, multifactorial disease. You know, medicine and even sometimes with functional medicine, it's not a pill for just like one pill, this will fix it, because it's a multi-causal thing. We have to find out how each of these and which of these are affecting you. Just like we have to find out how, like why certain nutrients are better for you in your brain, whereas for somebody else, it might be inflammatory. They might have a reaction to it. So it's all about you and not just finding that one thing. And that's why medicine has failed at this. 99.6% failure rate. That is unbelievable. And that's why the rate of Alzheimer's has increased 112% over the last 30 years. You know, I hear on media and radio, and I listen to a lot of sports talk radio, or I had in the past, and they talk about how the nutrition is so much better nowadays and how, you know, the fitness is so much better nowadays. I'm like, well, then why are we getting sicker? Why are people getting sicker? And that's my next question. So we know about all this. Why do we still have this big of a problem?
Well, I think it's the system that we're in. You know, we have a traditional approach, a traditional system that's really built for acute care. So if you need the emergency room, if you get hit by a car and you need to go to the emergency room, then you're really happy that A, you have insurance, and B, you live in the United States because we have the best acute care system in the entire world. But we're trying to use an acute care system for chronic disease management, not chronic disease reversal, not chronic disease stopping, but managing it. And we usually manage that with a drug or a therapy. So with pre-Alzheimer's, the approach is usually first wait. So you go into your doctor and you say, I have these symptoms. What should I do about it? They said, well, you're going to wait. You either wait and come back to see your primary care provider in about 6 months to see if it's worse, or they say your symptoms are bad enough, you need to go see a specialist, a neurologist, and it takes you 6 to 9 months to even get in to see that neurologist. So that once you're to the point where you're bad enough and your symptoms are bad enough, they can give you a pen and paper test where you draw a clock and name some animals. And if you score low enough, they can give you a label. The label's a diagnosis. Once they give you the diagnosis, then they can code that so you can get reimbursed for it, right? And then maybe they can give you a drug or a therapy that's going to potentially mask the symptoms or slow the progression. And then from here you say, okay, great. I've got a label. Where's my plan? And the plan is we're going to manage this, and then we're going to monitor you. We're going to monitor that decline. And it shouldn't be this way, but this is the way it works with dementia and Alzheimer's disease and every step along the way up into that point. And to show you, Ryan, how ridiculous this is, I want you to think of a car, okay? So think of a car that you purchased 30 years ago, brand new, and it was great. And you loved this car, and you washed it every single week, and you changed the oil, and you put in the premium gasoline into it because you wanted this car to last a really long time. And then a few years later, you started washing it every other week. And then some gum on your shoe got on the carpet and you just left it there. And you started putting in the lower gas, the regular unleaded, because you didn't want to spend the extra 40 cents for each gallon of gasoline. I mean, that's expensive. And what is it really doing to the car? And 30 years goes by and that car is just sputtering and puttering, and you really are interested in finally getting it back to best shape again. So you bring it into your car doctor, your auto mechanic, sorry. So you bring it into your auto mechanic, and your auto mechanic plugs it into the computer, right? And goes, Ryan, you've got old car syndrome. You say, what? Old car syndrome? They say, yeah, I'm sorry. We can't do anything about old car syndrome. We just got to wait. We can shine it up and we can wash it to make it look a little bit better for you. But you're going to need to bring it back in about 6 months, and we'll plug it in and see again. You say, well, I don't understand. Why can't you check the spark plugs? Why can't you check the electrical system and the wiring, dig around, open up the hood? And they say, that's not covered by your insurance. And we don't really have a reason to do that. So, I'm sorry. This is what you got. And unfortunately, that's what the system does right now with pre-Alzheimer's. But there's a different approach. And we have to change our belief system just a little bit on this. And this is a sticking point for me. It always has been. But it's about insurance, right? So we have this belief about insurance that it's there to take care of us. And I want to ask the question to the audience, why do you have insurance? And Ryan, why do you have insurance? Is it to maintain and improve, or is it in the case of disaster?
Disaster.
Right.
That's what it's for.
Every other insurance that you have in your life is for disaster. Your automobile insurance, you're not going to expect that insurance to pay for the premium gasoline. You do that on your own. You wouldn't take out your insurance card and bring it to the auto mechanic for your oil change. They would laugh at you. But for some reason with health insurance, especially as we age, and I talk to hundreds of people every couple of weeks, and they have Medicare, and they expect Medicare to keep them healthy. And it couldn't be further from the truth. Insurance is not there to keep you healthy. It's there in case of disaster. And that's because we have an acute care medical system. We have all these chronic diseases that are taking 86% of the dollars that are going into our insurance system, which is almost a quarter of GDP, Ryan. A quarter of GDP is spent on health. But it's not health. It's disease management that we're spending all that money on. So you need to be able to think a little bit different, that you may need to invest in your health. And I know that your followers, people who have already signed up for Superhuman Brain and are going to go to the Leaky Brain Summit, all those people are ready to invest in their health. So they're already that first step along the way. That's the most important belief system change that you need to make.
And I understand it can be hard for people because they've been trained to think one way. They've had insurance their whole life, and they've used it. We use it in our office as well. We've used it, but this is different than acute care. And you've been involved in research, which is, man, groundbreaking and amazing when I saw that. And it's taking a different approach. It's taking not the traditional systems, or I'm sorry, not the, how did you say that? The disease management. I love that term better than sick care because it's disease management. It's not even, I guess you could call it care, but I want you to go over some of this research because it's truly amazing.
Sure. So what we've seen over the last decade is that the research is pretty clear and compelling. As long as you can get past this idea of a double-blind, placebo-controlled, randomized, gold standard clinical trial, which was designed for a drug. You have a drug and then you have a sugar pill or a placebo. And that's how those studies are designed. It doesn't work for anything but a monotherapy. So when you can get past that idea and you go into this idea of a multi-causal disease needing a multi-domain approach, then we have two sides of the story. We have the precision medicine, which is very simply a systems medicine approach of what are the underlying causes and how do we fix those? And then lifestyle. So it's the how do we get you healthy and then how do we keep you healthy? And they both mesh together. You can't have one without the other if you're going to make progress. So here's just a sample of some of the studies that have happened over the last half a decade that have shown that this precision medicine and lifestyle approach really works. And each one of these is built upon one another. I was very honored to participate as a co-author and share some case studies with Dr. Dale Bredesen, who's a neurologist who wrote The End of Alzheimer's. He has another book coming out, which is going to be fantastic with a kind of a step-by-step approach. And in 2018, we showed 100 patient cases with varying forms of pre-Alzheimer's, all the way up to people actually diagnosed with forms of dementia, showing improvements in brain function and lowering the risk of developing dementia. It was just amazing work. There was collaborative work between multiple different clinics around the country. And what we're seeing, the key points in this, is that you must be able to identify the root causes to the disease, put somebody on a personalized plan. You must be able to show them a guided path towards the lifestyle changes that they need to make to affect both those underlying causes and their long-term results. And that individual must participate. What Richard Isaacson in 2019 showed is that if people participate in a plan over a 60% level, they get better, even with mild cognitive impairment. If they don't participate, they don't get better. And in many times they decline. So what we did is we said, well, that makes a lot of sense, but what if it's too complicated for people to actually participate? And that's where it comes into making it simple. And I know that, you and I have talked about the different approaches and the mnemonics and everything. And we're going to get into this in a little bit. So let's talk about that, because I think that's going to be really interesting between these two sides, right? The precision systems medicine and the lifestyle. And we use mnemonics because they're easy to remember, but it's just a mnemonic. So ours is my details for the precision medicine. We believe that medical doctors need to guide this. We understand that you have your own unique genetics. There's your immune system and your energy regulation. You're avoiding toxins in the environment, how you assimilate nutrients like food and air and water in your system, information flow of hormones and nerve cells and neurons, the communication in your brain, and then how you move those nutrients around in your body through your lymphatic and vascular system. And then, of course, structural integrity, your bones and your muscles and your fascia, connective tissue, holding it all together. And so, Ryan, I know that your program hits on every single one of these as well, just with a different mnemonic, right?
Mm-hmm. Yeah, I mean, it's called the six pack of brain health, six pack of longevity. It covers all these areas. And as we get into the lifestyle part of this, you'll see it even more how it relates to that. Because, for example, mindset, for that, it's, focus and mindset. That is one of the core things of my mnemonic is, focus, food, fitness, function, refresh, and faith. And I say, if people really want to be a go-getter, we can make an 8-pack with faith and fun. I'm sorry, not faith and fun, but family and fun.
Family, right.
Because faith is part of the 6-pack, yeah.
Yes. Excellent. Yeah. And what we've realized is that all of these individually, both on the My Details, which is the precision medicine side, and the My Results, which is our mnemonic for the lifestyle side, and your 6-pack and 8-pack, every single one of those are individually scientifically validated to either increase your risk of dementia or lower your risk of dementia, depending on how you're doing them. You combine them together and you either have a really bad story or a really powerful story for your trajectory in your health path.
Yeah. And when I first saw this, I was like, that mindset, yep, focus, your unique self, how we identify that, reduce stress, that's focus and faith, eat for brain power, there's your food, fuel, and nutrition, sleep well, that's what I call refresh, uncover your purpose, that's faith, learn new things, that's focus. I mean, all these are covered. And I love that it's all backed up by the research.
Yes, absolutely.
So how do we make it? I will say this. We use mnemonics, like you said, but a lot of times the listener, the attendee, the general public just sees that like, oh my gosh, it can create this overwhelm because it's just all out there instead of in a nice, organized fashion.
Right.
How can we get over that?
Well, I think that's one of the key problems. Once people get over the hump of there's nothing I can do and I have to live in fear. Once they get over that place and they say, there is something I can do, I don't have to live in fear. The next step is, oh my God, I'm completely overwhelmed. I don't know where to start. I don't know who to follow. I don't know who to guide me on this. They read these books and they're so complex that even a doctor can't actually assimilate that and break it down into a simple program. So you need to exercise and balance your hormones and increase your BDNF, brain-derived neurotrophic factor, and lower your blood sugar and increase your socialization. But where do you start? Because it's also personalized and it's unique for you, different than your spouse or another loved one or even your neighbor. So that is what we did at Mios Health. We decided to make a solution out of that because we saw a gap between the expertise of the medical providers, the doctors who have that advanced training in reversing cognitive decline, and the clients who really want to implement a program, because there wasn't one. There wasn't just a seamless program that led them step by step along the way. So we do two things at Mios Health. We reverse pre-Alzheimer's and we improve brain function, overall quality of life. And we start by first understanding what's driving the decline, right? We talked about that with all those different risk factors, different underlying causes. And from that, we can very easily design and deliver a personalized functional medicine. You can call that integrative medicine. You can call it systems medicine approach and a lifestyle program. And they go hand in hand. And it's usually a 6-month program. And it's every step along the way of what you need to do to get to those goals. And then we believe that you must have a team approach. No one doctor is going to be able to get this done alongside of you, but a doctor and a health coach and your primary care provider and your spouse or your friend working as a team around you at the center, that can help you get the job done, right? One person on a basketball team is not going to be enough to win a championship. You have to have a whole team working together and they must know the fundamentals. And one thing that's really important is measuring progress and sustaining results. So you can't just measure once and say, all right, here are the problems, let's go. Because with brain function, it changes so incrementally that you need data to actually show you that you're improving before you even know that you're improving and that you're on the right track. And then you must measure again at the end all the stuff that you measured in the beginning to show you what that objective change is, to make sure that you've actually changed the underlying conditions that were leading to decline in the first place, and that you're not missing anything. And all of this is great, but none of it works if it's just siloed. So we had to build a proprietary engagement platform, an integrative solution, which is a technology platform that we designed to coordinate all of this so that your primary care provider knows what's going on, so that your health coach and your doctor, your integrative doctor, are actually communicating with each other. So when we bring in a lifestyle expert like Ryan to work on a case, we know that Ryan, you don't have to sit there and catch Ryan up for the first 20 minutes of your consultation of what the other person did. He already knows exactly what's happened because it's all integrated together in that one solution that tracks your data, that shows you the progress, that keeps the team in place. And that way you can make reversing cognitive decline simple. And that's where it really aligns.
And I love that word. I'm glad you ended with that, was simple.
Yeah.
Because if it's too complicated, we live in this world. So sometimes it's I want to say common knowledge or common sense to us. A lot of people don't. So we want to definitely make it simple. And that's what drew me to you guys and impressed me with Mios is it's not another clinic with another program. It is, it's simple. I was drawn to it for me, but then also as a way to help my clients too, just like you said. And the principles, you already touched on a couple of them, but the principles that you guys have for the team and everybody else at Mios in this participation, I love that. So are there any other principles that you have for Mios?
Yeah. So the first one is we believe you must invest in your health. It can't just be the insurance premiums that you're paying, thinking that's going to keep you healthy, but you must understand that investing in your health, like investing in your retirement, you wouldn't expect Social Security to provide you with the lifestyle that you want to have when you retire. So don't expect Medicare to provide you with the quality of health that you expect when you get to that point either. So you must invest in your health, and the earlier you start, the better off you are. We believe that health is a team sport, like I said earlier. So you need that integrated approach. And it's not about replacing your primary care provider. It's about coordinating the effort with that individual, making them feel like they're a part of a team around you. You should be the one in the middle, in the center of that. We also believe that what you can measure, you can manage. We talked about measuring progress to sustain results. If you're going to try to lose weight, what's the first step? You step on a scale, right? You want to know how much you weigh. And step number 2 is usually you set a goal of how much weight loss you want to have, and usually a time frame of when you want to lose that weight in. And then step number 3, you go figure out how you're going to do that. Now, some people want to do it themselves and they know how to do it. They know the best way. Others read a magazine article and that's what they're going to follow. Some people want a full integrated solution. They hire a trainer and a nutritionist and an online program to help them lose weight. And all of them have varying results for different people. But you must measure what you can, or you can manage what you can measure. And so we start by measuring people's brain function and giving a baseline from which to improve. And Ryan, we've done this, right? We've shared this with you. And it's amazing to see on paper what's going on in what areas. I mean, this is what set me on my health journey. And now it's easier to do than ever. And then finally, what I believe is our most important principle is we believe that you should pay for results. And what that means is if you're going to commit your time, your effort, and your money into a program, then you should reach your goals in a specific amount of time. If you're going to participate, you should get there. And if you don't, you shouldn't have to pay for all of that stuff. There's no other business in the world that just says, sorry, this is all on you. I mean, if you can buy a mattress now and sleep on it for 100 days and on 99, day 99, you can send it back if you're not happy with it, then why can't we establish some guarantee of a partnership in health? And we can. You can't in insurance, but outside of insurance, when you're investing in your own health, you can start paying for results. And so that's what we do. Those are our principles at Mios Health.
I mean, did everybody hear that? Like actually guaranteeing the results. I have patients every week or clients, approaching me or ask, that's one of the questions, like, how do you know this is going to work? Well, this is creating that baseline, setting the goals. We have to know what work actually means to the individual. And that's amazing. And these principles, this system, what it's designed to do is, correct me if I'm wrong, just it increases the likelihood of success, correct?
Yes.
And you mentioned, and it was what, 60% in the study that you did, as long as they participate?
Correct.
In that study or the 2019 study, one of those two, if it just 60%. So many people think it's got to be all or none. I got to be perfect in order to get the results. Yes, the closer you are to that, the faster you're going to get those results. But man, I mean, this is, we're about to go into the Q&A here. But first I want to make sure I give this to you. If people wanted more information, wanted to know how they can measure their brain function, how can people do that are watching?
Well, thanks, Ryan. So we have a pretty simple 3-step process. The first is you have to establish your baseline, right? Measure what you can manage. So establishing your baseline is understanding your brain function. It takes about 30 minutes from the comfort of your own home. It's a 8-step process of tests, kind of feel like computer games, but they're very fast and accurate. And they measure your brain function against that of your peers, your age group, and your gender. And we do that with a couple of subjective questionnaires that are validated, and we pull all of that data together on one report. And that's your new, what we call cognitive baseline, a new point from which to improve. And you can tell if it's normal, or you can tell if it's accelerated cognitive decline at that point. But you can't be fearful there, because we're going to set some SMART goals, right? Specific, measurable, actionable, realistic, timely goals that we can reach in a 6-month period of time. And now we have this gap. We have your baseline, and we have these goals that you want to reach. So we then create a personalized plan, and that plan fills that gap. And it's the team approach to really help you reclaim your future. So before we jump into the Q&A, what I want to do is I want to offer to the individuals, the attendees here today, I want to offer to take those 3 steps, not just the first step, but all 3 of those steps. So Brian's going to put up a link in the chat box, and we'll email it to everybody after this as well. But what that link is it's measuring your brain function. So this is getting your cognitive baseline report. It is spending 1 hour, and I promised Ryan that anybody, any member of his audience, his tribe who is watching this, they will get me on the phone. So we're going to spend 1 hour together in a session going over your cognitive baseline and then creating that personalized plan. So you get to establish your baseline, establish your SMART goals. We'll do that together and create your personalized plan. There is a charge for it because, as you heard, it is one of our principles. Investing in your health is so important. So if you're not willing to put $97 down, then we don't know if we should spend all of that time, right? This time is valuable for us. A lot of people wanting to work with us. And so we charge a very nominal fee that doesn't even cover our time or the cost of the tests to make sure that people are willing to invest in their health, to take those first 3 steps that are so important. And so Ryan, we'll have that. There's the note in the chat box, but it's time to take action. If you've never measured your brain function, then this is a really simple, accurate, fast way to do that. And Ryan, you've had the experience. We've done this together. It's pretty eye-opening and pretty easy as well. So I'll leave it with that.
Yes, and again, we're not going to hard sell on it. If you've been listening this the whole time, you know how important it is. But I'll just tell my experience with it. It was like I was excited to take it because I've never done this test before, even though I'm in the brain health world. So it was really interesting to see all the different aspects of brain health function, and Seth can go over those with you. And then meeting with Seth, going over the results, he did that with me as well. And it's, and one of the questions that sometimes I get is how early is too early to get a baseline? Right. I mean, if you can read and use a computer, it's not too early. Am I right about that, Seth?
That's right. Yeah, we suggest at any age, because then if something happens, you have a point to measure from and a point to get back to. Okay. So it's really, really important at any age to be able to do that. So I know, Ryan, we're going to have some questions here, and I know that there's already some popping up. I will let you moderate those questions and start picking and choosing from them. And let's answer some questions for the audience. It's been patiently waiting for about 40 minutes.